Sign and symptoms of colorectal carcinoma. This is carcinoma which starts from the inner lining of the large gut, that is colon and rectum. It is a very insidious, slowly growing and progressing carcinoma. So the symptoms appear very slowly, and initially there is no evidence of the cancer by the symptoms. But when it has progressed, so it produces symptoms of abdominal cramps, pain, tenesmus, constipation, nausea, vomiting, melena, that is the rectal bleeding, due to which anemia is produced, and the symptoms due to anemia: palpitation, heartbeat rate increased, tightness of the chest, breathlessness, and fatigue symptoms. There is also depression, hallucination, illusions, neurological symptoms, and weakness. These are the various symptoms they are produced. But mainly, these are the abdominal symptoms, because when the carcinoma passes or merges into the final stage, that is metastatic stage, when the cancer cell, by means of lymphatic and the bloodstream, goes to the various organs of the body and produces their secondary carcinomas. So according to the organ inflicted, that produces the symptoms according to the function of that organ. That these carcinomatous tissues, they lodge in the lungs and produces the respiratory symptoms. That goes into the liver, produces liver secondary carcinoma, liver symptomatology, that is there is jaundice, there is ascites, loss of appetite, loss of weight, and then it goes into the brain and then produces the various amnesia, dementia, according to the organ involved in the metastatic state. Now the diagnosis of the colorectal carcinoma. Fecal blood test for the detection of the blood. Then we also perform blood test for detection of the antigen produced by this carcinoma or the cancer cells. The level of that protein or antigen is elevated. In addition to, we perform plain X-ray of the chest, abdomen, CT scan, PET scans, MRI. By these radiological imaging tests, we detect the location of the carcinoma, size of the carcinoma, and shape of the carcinoma, extent of the carcinoma, by means of these tests. But the most reliable test, or the most modern test, that is the endoscopic test. Endoscope is an instrument in which there is light, video, and the tools openings. This instrument, under general or local anesthesia, is passed through anus into the large intestine, and the anterior of the large intestine, including rectum and the colon, various parts of the colon, they are visualized on the monitor or the TV camera. And this is the exact and the modern way of detection the location of and size of the tumor. Moreover, by means of this endoscope, which has been termed as colonoscope, as sigmoidoscope, according to the part of the large intestine. So we can also perform biopsy test. We pass an instrument or the forceps and dissect the various parts of the tumor and send to the laboratory for the cytological study so that we can know about the type of the carcinoma as well as grading of the carcinoma. And that is only done by the biopsy procedure. That is resection of the tissue of the tumor for study of morphology of the and the cytology study of in the laboratory under the microscope. So this is the main test, which is a reliable and it is a very important test one.